BBC Radio Shropshire.
8:23 on The Breakfast Show here on BBC Radio Shropshire. As you've been hearing already this morning, volunteer drivers who help take patients to and from hospital are helping to relieve pressure on the NHS in Shropshire. The scheme was developed by Shrewsbury and Telford Hospitals NHS Trust alongside a healthcare charity called Helpforce. The service helps patients who need regular treatment like kidney dialysis or those who just need a lift home after being discharged. Robert Turner is one of the volunteer drivers, and he's been talking to BBC Radio Shropshire.
Well, I became a volunteer driver to try and give something back to the NHS, albeit in a very modest way. I've turned 75. I've been an NHS patient all my life, so I really value the service, so I want to give something back. Well, if they've been in hospital for more than 24 hours, we go in with them, walk them into their house. Sometimes they need an arm to rest on. Mostly they're okay, but check that they've got electricity, heating, water, because who knows? I mean, people have had their meters run out while they've been in hospital, and it's all, when you're feeling a bit frail and uncertain, it's nice to have somebody there to help them. To begin with, they think they've got to pay, or they're not sure about the situation, and I'm very pleased to tell them, look, it's good old NHS, you know, it's free at the point of delivery, so you don't have to pay.
That is volunteer driver Robert Turner. Well, Mark Burrett has been leading this project for the charity Helpforce and is with me now. Good morning, Mark.
Good morning, Adam. Hi.
That's nice to hear from Robert there. I like that. He's glad to tell people this is all part of the NHS.
Oh, it's wonderful. I mean, Robert is just one of so many giving volunteers contributing to their community and really helping hospitals. I think improving patient flow is critically important in helping to bring down waiting times for NHS treatment. Over 6 million patients currently waiting for care across England. And Robert is one of the discharged volunteer drivers helping to do that at Shrewsbury and Telford Hospitals, yeah.
So what's your involvement been within this project? What does a driver get up to in a typical day?
So our role at Helpforce is about accelerating the growth and impact of volunteering. And we're proud to have worked with Shrewsbury and Telford Hospitals NHS Trust on this innovative volunteer discharge driver service, which is having a profound effect on both hospital efficiency and patient experience. And we've worked with a number of other NHS trusts across the UK in developing a volunteer discharge driver service. And in short, it's helping to speed up the transport of patients from home from hospital back to home. Over a 6-month period, 17 volunteers at SAF completed 660 journeys, providing support to patients who qualify for non-emergency hospital transports and those unable to get home independently. And I think talking about Nicola, who's been happy to tell her story, who attends hospital 3 times a week for kidney dialysis, as describes the service as being an important and a real lifesaver in not being able to wait around 2 hours, but being able to get home safely and have a friendly chat on the way. And for those that have been discharged and had surgery and so forth, as Robert described there, you know, are able to provide a bit of a settling in service once they're home, which of course all helps from people returning back to hospitals from a readmissions perspective.
So as you say, Mark, it's not just driving, it's settling people into home, a home that's so important to them to be at.
Yeah, very much so. I mean, some of the other tasks the volunteers do is deliver medications, equipment and discharge letters. And more recently, the initiative was extended to provide outpatient support. So a volunteer driver could take someone home, but on the way back, pick someone up to make sure they get to their appointment, and subsequently avoiding a did not arrive, which again is a cost to the NHS Trust.
So this is making a difference, isn't it, to the NHS Trust?
Well, look, I mean, at the end of the day, this 6-month pilot, with the number of journeys that are undertaken, has almost helped to avoid £86,000 being spent on other hospital transport and taxis by using volunteer drivers. And if we think about the 200 NHS trusts across the UK, and if everyone was to adopt this programme, you could be looking at an annual saving of around £30 million.
A lot of money. Obviously, other NHS trusts have volunteer drivers. What do you think sets your scheme apart?
Well, as I say, I think it's just about drawing on the spirit of the community. People like Robert and so many others, looking at Shrewsbury and Telford, a lot of the volunteer drivers, many are ex-servicemen, have come from the armed forces community, got a bit of time to give to the community, give to the hospital, and are willing to do so. And potentially haven't had the opportunity, a service like the volunteer discharge driver, to engage with, to be able to do that, want to give something back, but unsure how. And here in Help Force, we design so many different types of volunteering services, all to help reduce the pressure on the NHS and help volunteers. You may remember I was on your programme some time ago talking about the Volunteer to Career programme, providing a career pathway. And I think what's interesting from the evaluation that we did on this programme, a lot of volunteers have said that the experience has provided them with a sense of purpose and has allowed them for skill development, and for many more to pursue careers within the healthcare sector that they didn't have the opportunity to do so before.
There's a lot of people getting a lot out of this, isn't there? Not least your volunteers. I mean, the sense of accomplishment and helping your community must be enormous at times.
Yeah, I think so, Adam. And I mean, there's still a general perception that volunteering is nice to have, whereas here in Help Force, through all the work that we've done, working with over 150 healthcare partners, and the amount of volunteering services that we developed as a very small charity as we are, we know that it's essential and it can help. The NHS, our wonderful NHS, it can help it. It's got to be a community effort, and I think volunteering is one of those vehicles that people can engage with, that have the time and capacity to do so.
Mark, great to talk to you this morning. Thanks very much for your time. That's Mark Burrett, who's been leading the project that you heard about there with the charity Help Force, making a big difference, as you heard, to NHS Trust with their volunteer drivers and that home settling in scheme as well. It's 8:30 on Tuesday morning here on BBC Radio Shropshire. Maybe you have been helped in some way by that scheme, which, as you heard, has saved Shropshire hospitals tens of thousands of pounds as well. I'd love to hear your thoughts. 08000 321 333 on WhatsApp, and make sure you start your message with the word Shrop. It's 8:30, and that means it's time for your news and sport headlines with Carly Swain.